Dr. Linda Gromko, and this is Transgender Medicine Made Simple. Today we're looking at the pros and cons of orchiectomy, or the removal of the testicles. So first of all, let's define orchiectomy, or more properly, bilateral orchiectomy. Bilateral orchiectomy is an outpatient or day surgery that's done to remove both of the testicles, hence bilateral. Today we will look at this in the context of treating gender dysphoria. Now, in this picture, you can see the arrow is pointing towards one of the testicles. This is a half view of an individual. So here's another view. The testicles are removed by using a midline incision in the scrotum, and the testicles are shown with the yellow arrows below. The testicles are removed as part of gender-affirming vaginoplasty surgery anyway, but they can be removed before or instead of vaginoplasty surgery. Here's what happens after the testicles are removed. First of all, a person's testosterone level drops considerably and permanently. A person no longer produces sperm, so they can no longer impregnate a sex partner. The sex drive or libido will decrease right away, but it can adjust some over time. Erections will be less strong, but there are medications that can correct this if desired. I'm talking about Viagra and Cialis and others. Let's take a look at some of the pros and cons of orchiectomy, starting with the pros. First, gender dysphoria is usually reduced. Secondly, a person can stop taking testosterone-blockers like spironolactone. And when they stop the spironolactone, they stop the side effects of spironolactone, like being a diuretic or peeing all the time. So a bilateral orchiectomy reduces testosterone effects such as body hair, oily skin, or an annoying libido. Fertility will end, which is a good thing if this is desired. The testicular cancer risk goes away. If vaginoplasty is desired, it can be done at a later time. This doesn't eliminate the possibility of that. And a person can experience a great deal of relief. So here's some cons. Now remember, depending on which side of the statement you're on, what's a con can be a pro. So here are some cons. First of all, orchiectomy is irreversible. There's no way back. So a person must be absolutely certain that this is what they want to do, of course. Number two, fertility ends. This, of course, is also a good thing if desired, but banking sperm ahead of time, in fact, ahead of taking estrogen at all, can help to preserve fertility. Testosterone level is lowered, also a plus. Another con is that a person becomes dependent on hormones. Now, this isn't like being addicted, but it does mean that a person needs to take hormones for life to protect their bone density, their bone health, and their general well-being. As mentioned before, there's a decrease in libido, but the erectile capacity can be addressed through certain medications. And remember, it is a surgery, so complications can exist with any surgery. So, bilateral orchiectomy is a safe and quote-unquote easy way of reducing testosterone levels without the side effects of testosterone blockers. It can reduce gender dysphoria quite a bit, and as in all surgeries, a person must be clear and well-informed about the risks that are involved. Now, my picture of frozen peas is to remind me that many people will use frozen peas as a pack over the scrotum, and this helps with swelling and pain after the procedure. But when I say it's an easy way, I mean, of course, it depends on which side of the surgery you happen to be on. It's not without its issues or problems, and I do understand that. So that's all today. This video is generated from the questions of a viewer. If you have a question you'd like to see entertained, leave it in the comment section below, and I'll try to address it. Don't forget to subscribe to my channel, Transgender Medicine Made Simple. Thank you so much for watching. I'll see you in the next video.